As we age, we begin to treat your health differently. I want to make sure that everything is okay, prevent diseases in advance, do that, what will help you live longer and more peacefully. It is a natural desire to take care of yourself. When you understand how fragile life is and how quickly it passes, but sometimes excessive caution turns into anxiety. We hear more and more often, need to get checked, I need to get tested, undergo an examination. And now concern for health is no longer a source of confidence and a constant cause for concern. After 70, our body changes. He reacts differently to stress and medications than before. And those procedures who helped in 40 or 50, in later life, they may not be beneficial, and fatigue, stress, and even complications. This does not mean what to avoid from doctors. It's just important to understand the limits. The true wisdom of age is not in that, to cure everything in a row, and in that, to choose carefully what you really need. We'll look at 5 common tests which are often prescribed to older people, and let's talk about that, how to treat them without fear and extremes. After all, sometimes the desire to get checked just in case turns into a trap, where prevention becomes a test and the attempt to prolong life is a source of unnecessary anxiety. First, colonoscopy. This procedure has long been considered the gold standard for preventing colon cancer. She really saved a lot of lives. But after 70, the situation becomes different. Preparation for the procedure requires complete bowel cleansing, which can be a serious challenge for an elderly body. Fluid loss, salt imbalance, weakness. All of this can cause dizziness or falling. Besides, the procedure itself is performed under light anesthesia, which lasts longer in adulthood and can cause drowsiness, instability, and sometimes confusion. There is another side, psychological. Even if a person feels well, detection of the slightest changes, for example, small polyps, may cause anxiety. The doctor prescribes a repeat examination, biopsy, and a chain of experiences and new procedures begins. However, many of these findings are harmless in old age, grow slowly, and do not affect the quality of life. But anxiety has translated from Russian to English. www.onlinedoctranslator.com already settled in, and it is capable of causing more harm than the disease itself. This does not mean that colonoscopy is dangerous. Not at all. It remains an important diagnostic tool when there are real complaints, pain, weight loss, blood in the stool, family history of diseases. But if there is none of this, and my health is stable, you can choose soft ones, gentle methods, a simple stool test for occult blood, or a consultation with a gastroenterologist without instrumental interventions. It is important to remember that prevention should not become a test. In adulthood, self-care is not about trying to do as much as possible and the ability to stop in time. Each of us deserves careful attention, careful attitude, and on the part of doctors and from myself. When you doubt, is this or that examination necessary? Just ask the doctor a question. Will my treatment change if I pass it? If the answer sounds unconvincing, maybe the procedure really isn't that necessary. Let your self-care be gentle and mindful. Don't be afraid to trust your body. Listen to his signals, but don't turn your life into an endless wait for bad news. After all, true prevention is not a set of procedures and inner peace, movement, a kind attitude towards oneself and the joy of every day lived. Second, full body scan. In recent years, it has become fashionable to undergo so-called complete body examinations. They are also called check, APME, or total scan. At first glance, the idea seems great. In just a few hours, modern technology scans the body from head to toe and reveals the slightest deviations. Seems that it gives you peace of mind because now you know for sure that everything inside is under control. But in reality, it is precisely this desire for complete knowledge that often turns into anxiety and sometimes unnecessary interference. When doctors do an MRI or CT scan of the whole body, they see not only real diseases but also many random finds. These may be small nodules, cysts, light shadows in the picture, that's it, which does not affect well-being in any way, and often does not develop for years. However, for a person these words sound frightening. He's starting to worry. Revise the results, go to the doctors, look for confirmation. And very often one finds oneself drawn into an endless chain of new examinations, biopsies, and tests. All this takes time, strength, and money, and most importantly, it steals peace. There is even a medical term, overdiagnosis. This is the situation when they find a problem which would never cause harm if they hadn't just found out about her. But knowledge makes you act, because fear is stronger than logic. This is especially difficult to bear in old age, when any medical procedure, from an injection to anesthesia, is more difficult than before. Many elderly patients tell that after such examinations, their life turned into an endless series of consultations. They stopped sleeping peacefully, were expecting bad news, lost self-confidence. Sometimes it ended in small but still operations after which it took a long time to recover, and all this for the sake of discoveries which would never affect life expectancy. Certainly, modern technology is a great achievement, but it's important to remember, the more sensitive the device, the more he sees. And he sees not only diseases but also features which do not require intervention. Therefore, a full body scan in older age is not always useful. It may bring ignorance and anxiety, no relief, and unnecessary doubts. Doctors are increasingly talking about this, that after 70, prevention should be selective, address based on specific complaints and not out of curiosity. It's better to discuss it with your doctor. What tests can really help improve quality of life, and some will simply waste their energy. There is a simple rule: any examination makes sense only then when the action depends on the result. If after MRI, CT scans or tests will not change anything in the treatment, maybe they don't need to be carried out. Sometimes it's better to observe what to look for. For an older person, health is not an endless struggle, and the art of balance. Keep a clear mind, lightness in the body and interest in life are much more important than endlessly searching for hidden diseases. And if we talk about prevention, then it should not be in devices and scanners, and in motion, good sleep, calm and good mood. A complete examination may be helpful if it is carried out for a specific indication. But do it annually for no reason means exposing yourself to unnecessary risks. After all, every discovery requires an explanation, and every explanation creates new anxiety. In adulthood, it is worth choosing peace and confidence, and not fear before every photo. Real self-care is not a test of strength and respect for the body, which has served you faithfully for many years. Sometimes the best way to maintain health is to simply allow it to be in balance. Third, excessive cardiac tests. The heart is one of those organs which comes under special attention with age. We listen to every interruption, to every push, to any change in pulse. And this is understandable. The fear of a heart attack or stroke is one of the strongest fears among older people. Therefore, doctors often prescribe numerous examinations: cardiograms, Holter monitoring, stress tests, ultrasound of blood vessels, angiography. All this seems necessary. After all, we are talking about the most important organ. But often these checks turn into something other than concern, and in case of excessive load, physical and emotional. In middle age, such procedures really help to notice the problem in time. But after 70, everything becomes more complicated. The heart ages along with a person. Blood vessels lose elasticity, the pulse becomes a little slower, pressure may fluctuate. These are natural changes, and not always signs of illness. However, when such features appear in the ECG report or exercise results, the doctor, according to protocol, sends you further for additional tests. And now the calm person turns into a patient who undergoes one examination after another. So-called load tests raise especially many questions. At first glance, it's a simple procedure. A person walks on a treadmill or pedals, and the doctor is observing how the heart reacts. But for an elderly body, this is a severe test. Even a small amount of physical activity under stress and anxiety can cause vascular spasm, arrhythmia, or a sharp drop in blood pressure. There were cases when people were admitted to hospital after a preventative test, which they didn't need initially. The emotional side is no less disturbing. After such examinations, a person begins to live under constant pulse monitoring. He measures his blood pressure 10 times a day. Afraid to go outside, gives up familiar joys, walks, meetings, even from a cup of coffee, so heart, which previously served faithfully, turns into a source of fear. But it is, like no one else, does not need fear, but in peace and trust. This does not mean that cardiological examinations are harmful. No, they can save lives if there are real symptoms. Pain, dyspnea, rapid heartbeat, sudden weakness. But doing them just to check means exposing yourself to unnecessary worries. Doctors say after 70, it's much more important to monitor your blood pressure over the years, sugar and cholesterol levels, than undergoing expensive tests, not having specific indications. An elderly person's heart does not need constant checking and in care. A calm rhythm of life is good for him. Walks, breathing exercises, light physical activity, and good emotions. True prevention of heart disease is not about machines and tests, and peace, moderation, and joy of movement. If your doctor suggests you undergo an examination, don't be afraid to ask a question. And what will change? If the result turns out to be slightly worse than the norm, will treatment be needed? Or is it just an observation? Sometimes it is enough to keep a diary of your blood pressure and pulse at home, so that the doctor can assess the condition without putting unnecessary stress on the body. The heart does not like vanity and fear. It is grateful for the soft rhythm, for walks in the fresh air, for sincere conversations and quiet evenings. And if you give him all this, it will provide you with reliable operation for many years to come. After all, the strength of the heart is not measured by the number of examinations, but in the ability to enjoy life, despite age. Fourth, aggressive cancer screenings. The word oncology scares almost everyone. Even if a person is outwardly calm, there is always anxiety inside him. What if something happens? It grows. What if an important moment was missed? That's why, when doctors or advertisements suggest taking tests for tumor markers or undergoing screening for early cancer detection, many agree without hesitation. Seems the sooner you find out, the better. But in old age, this rule does not always work. Oncological examinations, mammography, PSA test for men, fluorography, biopsies are important when there are symptoms or risk factors. However, for people over 70, they often cause more anxiety. What's the use? The thing is that many tumors at this age grow extremely slowly. sometimes so slow that a person will live for many years without ever experiencing any harm from them. But if such a discovery becomes known, a completely different story begins. Anxiety, examinations, interventions, expectation of bad news. This is how psychology works. Knowledge unnecessarily turns into fear. A person begins to live with the thought of illness, even if doctors say that the situation is under control. Sometimes this leads to surgery or treatment, which in itself can be more severe than the disease itself. In older age, anesthesia is more difficult to tolerate. Recovery takes longer, and stress after hospitalization can affect the entire state of the body. There are many stories when the examination was carried out just in case, and a find, barely noticeable in the photo, became the cause of long months of unrest. One elderly man recalled how I got a PSA test on a friend's advice. The indicator turned out to be slightly higher than normal. Consultations have begun. Biopsy, treatment. In the end, it turned out that there is no cancer, but he lost his peace of mind for a long time. And there are many such examples. Doctors are increasingly talking today. In old age, it is not so much worth looking for diseases. How long should I monitor my condition? If you feel well, you don't lose weight without a reason. You don't have any pain or obvious changes. There's no reason to panic. But if specific symptoms appear, then an examination is really necessary. Prevention must be reasonable. It shouldn't turn into a marathon of procedures. If the examination does not change the treatment, if it does not provide a real improvement in the quality of life, means there is no need for it. Sometimes a simple inspection is enough. Pay close attention to your well-being and trust your doctor, who knows the peculiarities of your age. Cancer screening may be helpful, but it should not become a source of fear. It is important to remember that with age, the main goal of medicine is not to prolong years at any cost and make these years calm, bright, and meaningful. Each of us has the right to choose what examinations should I undergo and which ones to refuse. This is not indifference to oneself, but a manifestation of maturity and respect for one's own body. Life after 70 is time when there is no longer any need to prove anything. You just have to live with interest, with pleasure, with gratitude. Health is not just tests and diagnoses. It is an internal state of peace. When a person is calm, when he is not afraid, the body also breathes more freely, and this perhaps the best prevention of all. Fifth, overdiagnosis of blood vessels and brain. As we age, we think more about the brain and blood vessels. We are afraid of a stroke, memory impairment, dizziness, and doctors are willing to address these fears, prescribing all sorts of examinations: vascular Doppler, ultrasound of the neck, MRI of the brain, CT scan of arteries. It all looks impressive, especially when it comes to prevention. Seems the more you check, the calmer you will be. But in practice, it turns out differently. Modern equipment can detect the smallest deviations, tiny cysts, minor plaques, microscopic blood flow disturbances, and almost always these findings have no clinical significance. But man, having heard about them, begins to worry. He goes to a neurologist, then to a vascular surgeon, then to the cardiologist. Each specialist adds one tablet just in case. After a few months, the elderly man is already drinking a handful of medications in the morning and evening, not always understanding why exactly, and now instead of calmness, there is fatigue. Side effects, dizziness, and weakness. This situation is familiar to many. A man goes for an MRI of the brain just to make sure that everything is okay and comes out with a long list of incomprehensible terms. The report says atrophic changes, microangiopathy, small cyst. This all sounds scary, but in essence it reflects normal age-related changes which most people over 70 have. They do not require treatment and do not affect the quality of life in any way. But fear has already settled in, and it forces us to look for new doctors, new diagnoses, new pills. It is important to remember, examinations should help and not to scare. Do an ultrasound, CT or MRI is only worth it then, when there are specific complaints, pain, traffic violation, sudden weakness, loss of vision. Everything else is redundant. Prevention should not turn into an endless search for non-existent problems. The body of an elderly person is a system which demands respect and not control. She is grateful for the peace, dream, fresh air, and simple joys. If the vessels react to the weather, if you sometimes feel dizzy, it's not always an illness. This is life with its own characteristics, and the less fear there is in her, the better the body feels and soul. When you go for a checkup, ask yourself a simple question. What will change if the doctors what they will find it? If nothing, maybe you just have to let go of anxiety. Sometimes knowledge doesn't set you free, and vice versa, makes us hostages of unnecessary thoughts. After 70, it is important not to look for illnesses and maintain inner balance and gratitude for each day, which is lived with clarity and warmth. Let's sum it up. After 70, self-care ceases to be a struggle and becomes an art. The art of listening to the body, respect his capabilities, and do not overload him with unnecessary fears. Not every examination is necessary. Not every intervention is beneficial. True health is peace, moderation, attention, and kindness to yourself. Have you ever encountered this situation? When a medical procedure brought more anxiety, what's the use? Share your story in the comments. Your experience can help other people, those who is now facing a similar choice and looking for peace and not fear. And please don't forget to subscribe to our channel. Your support helps us create new videos. Warm ones, honest and inspiring, which resemble taking care of yourself doesn't start with pills and tests, but with respect for life and love for oneself. Take care of yourself. You are the source of wisdom, and your path is worthy of it, to walk on it calmly, without haste and anxiety.